Hello. Welcome to a brand new medical surgical nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please be sure that you have your notebook ready to take notes and you have your textbook available for reference. I encourage you to highlight any key points that remain unclear and to be sure to email me for any questions. This lesson covers the RN nursing care of disorders of the nose and sinuses, the oral pharynx and tonsils, laryngitis, and other lung infectious disorders. By the end of this lesson, you should be able to understand that sinusitis, pharyngitis, and tonsillitis are disorders nurses will see on a regular basis, and they should not be taken lightly just because they also can lead to more serious complications. You should be able to balance your knowledge of the varied disorders in the teaching process for patient care. You should be able to realize the many similarities between the disorders presented, especially in regards to pathophysiology and clinical manifestations and findings. You should be able to understand that disorders that are affecting breathing are not only life-threatening, but they cause a lot of anxiety for your patients. You should be able to provide holistic patient care, clinical decision-making, problem solving in patients with these disorders. Rhinitis is an inflammation of the nasal mucosa. It is most common problem in the nose and sinuses. We covered the sinuses and we have another picture here that shows us the nose and sinuses. On this side, you have allergic rhinitis. That's what we're going to talk about first. But really, there's other rhinitises, like a viral rhinitis is the common cold. It is caused by many viruses. Cold spread from person to person by droplets or on surfaces from sneezing and coughing. In teaching these patients with a cold, we want to remind them that the cold viral rhinitis is easily spread during the first 2 to 3 days after symptoms begin. We want to tell them that the management focuses on symptom relief. So we want to teach them that to wash their hands, to make sure that they're blowing their nose in the tissue, and we want to make sure that they have they're washing their hands. So let's go back to allergic rhinitis here. With allergic rhinitis, teach patients to avoid contact with offending allergens. Of course, it's not an infection, it's an allergen that's causing that. And you want to caution older adults using antihistamines that these drugs make their hypertension worse if they're already on antihypertensives. Okay. On the other side here is sinusitis. Sinusitis is an inflammation of the mucous membranes of one or more sinuses, and bacterial sinusitis is a problem that requires an antibiotic therapy. How is the patient going to know they need antibiotic therapy? If you see this picture, the frontal sinuses are inflamed and they have purulent drainage. Purulent drainage in the ethmoid sinuses, we got purulent drainage that they're blowing out. So when you're seeing purulent drainage or this yellow crud, then the patient is probably going to require an antibiotic therapy. When it's clear, like in allergic rhinitis, they would not need an antibiotic. Okay? Or if an antibiotic may be indicated if they have not had any response from just regular decongestant therapy. Antral irrigation, also known as maxillary and antral puncture and lavage, is an outpatient procedure to drain the fluid around the pus around the sinuses. That can be done, but it may not be necessary, and antibiotics should take care of it. Pharyngitis, sore throat, is going to be an inflammation of the mucous membranes here, as you can see in this picture, of the pharynx, caused by bacteria, viruses, other organisms. It can be caused by trauma, dehydration, some irritants, tobacco use, and alcohol consumption sometimes is an issue. We have to be able to distinguish between acute and viral pharyngitis. Your textbook has a chart that does a very good job distinguishing that. What we're going to do is we're going to need to culture we will do a throat culture to distinguish it from the viral group and strep. So that's the rapid strep test. Sometimes the results of a rapid strep test are not accurate, and really it is based on the technique that's been utilized to collect that culture. So if you're collecting a strep culture, you want to make sure that you actually culture the pus in the throat that you're seeing. Management of bacterial pharyngitis is going to involve the use of antibiotics and supportive care is provided for viral pharyngitis. You want to remind patients that are taking antibiotics for bacterial pharyngitis to make sure that they take the whole antibiotic. And the biggest thing about these patients, especially these little young ones, we want to make sure that they do not have any airway obstruction from this, and that any time that a patient is experiencing airway obstruction, we would make sure that they get supportive care for their airway, to protect their airway. A rare complication of pharyngitis is sometimes that people end up with epiglottitis, which is an inflammation of the epiglottis. This is an emergency, and it would require immediate care. Now let's talk about tonsillitis. Tonsillitis, way back in there, as you can see, it's an inflammation or infection and infection of the tonsils and the lymphatic tissue surrounding the tonsils. This can be severe, and it can occur in adolescents or in adults. Surgical intervention for tonsillitis may be needed for recurrent acute infections or even chronic infections that have not responded to antibiotic therapy, or if a patient develops a peritonsillar abscess and or they have enlarged tonsils and adenoids that are obstructing the airway. A peritonsillar abscess or quinsy is a complication of acute tonsillitis. The infection spreads from the tonsils and it goes on to the surrounding tissue, and it causes an abscess. Outpatient management with antibiotic therapy is done. Sometimes they'll do a percutaneous needle aspiration of the abscess if needed, and then we may also surgically remove the tonsils. Laryngitis is an inflammation of the mucous membranes lining the larynx or the vocal cords that may include or may not include edema of the vocal cords. It is an increasingly common cause. An increasingly common cause of laryngitis is GERD, and as you can see in this video, this is normal vocal cords and this is inflamed vocal cords. And you want to teach the patient and family about relief measures. You want to teach them about infection prevention and avoidance of alcohol, tobacco, and other pollutants. On your notes, I've included information about seasonal influenza and pandemic influenza. These are going to be something you need to study and make sure that you understand seasonal and pandemic influenza. And we want to make sure that we encourage our patients to receive the yearly vaccine to make sure to cut down on the spread. And you want to teach people to follow community infection containment procedures in a pandemic influenza situation. Pneumonia is pretty common, very common in fact, more than 3 million cases in the US alone per year. And pneumonia is when there's excess fluid in the lungs resulting from inflammatory processes that have been triggered by infectious organisms or inhaled irritating agents. Ventilator-associated pneumonia is on the rise, especially among patients with ET tubes in place and mechanical ventilation. So we want to make sure that we decrease the risk with meticulous nursing care and making sure that we're assessing patients. And diagnostically with pneumonia here, we're going to go ahead and do a chest x-ray and to look at the lungs. Remember that chest x-ray may not show changes 2 or more days after manifestations of symptoms. We want to make sure these patients are using their incentive spirometer. We want to make sure that we're administering humidified oxygen if needed, if they're hypoxic. We want to make sure that we are assessing skin and we're taking care of the checking their lungs and listening to lung sounds. Severe acute respiratory syndrome, or SARS, is a new virus from a family of viruses, the coronaviruses. This family of viruses causes many forms of cold, but SARS is a mutated form of the coronavirus that is more virulent and most than most of its family members. SARS is something that RNs just need to be aware of. You want to make sure the virus is spread by airborne droplet precautions, and you want to ask patients when they are presenting with respiratory infection if they have been to other countries where SARS is present, and you want to ask them their travel history. I just want to mention that so you know to make sure that you ask where your patients have been and in the history taking. Thank you. Pulmonary TB is a highly communicable disease transmitted through aerosolization. TB has a slow onset, and many patients are not aware of the symptoms until the disease has advanced. A diagnosis of TB should be considered for any patients with a persistent cough and any other symptoms such as weight loss, anorexia, night sweats, hemoptysis, shortness of breath, fever, and chills. What we're going to do with these patients, we're going to do a PPD test result. It's the most commonly used test to check for infection. Ask patients from other countries whether they have had a BCG vaccination. If they've had a BCG vaccination against TB, then the PPD test is contraindicated and is not a reliable indicator, but it is contraindicated. Combination drug therapy is the most effective method for treating TB and to prevent its transmission. You want to assess the patient receiving first-line drug therapy for TB for any manifestations of liver impairment, any dark urine, any clay-colored stools, or any anorexia, jaundice, sclera, and hard palate. You want to identify these patients to make sure that if they're candidates for directly observed therapy, that they are getting that follow-up. You want to teach women taking rifampin, as a drug that's used to treat TB, that it does reduce the effectiveness of oral contraceptives, that another backup birth control probably would need to be considered. Keep airborne precautions for any patients with TB and SARS is reverse isolation. You want to keep the door closed. You want to make sure that in the hospital the patient is going to be in a negative pressure room, and you should already know that. And in your textbook, you have a chart on TB drugs. Be sure to review that. A lung abscess is a localized area of lung destruction caused by liquefying and necrosis, usually related to a pyogenic bacteria that's gotten lodged in the lungs. Patients with this problem often have a history of pneumonia, of aspiration, of mouth, obstruction or something. Treatment involves antibiotic, or they may have to go in and drain the abscess. Inhalation anthrax is a bacteria infection that can occur through skin, the intestinal tracts, and the lungs. Inhalation anthrax is rare in the U.S., but has a fatality of nearly about 100%. It's not spread person to person, so it's pretty rare. You want to teach people who may be afraid of contracting inhalational anthrax that the disease is not transmitted from person to person. Pulmonary empyema is a collection of pus in the pleural space, commonly caused by infection, lung abscess, infected pleural effusion. Therapy for empyemas is focused on emptying the cavity, expanding the lung, and controlling the infection with antibiotics.